We should never forget our past and what our ancestors endured. The Bay Area Community Health Advisory Council was formed in 1995 to eliminate health disparities through innovative models of health education and services across the generations and in our diverse communities. We began with an effort around breast cancer awareness, and I'm just proud to say that last year we screened 330 women who either did not have insurance, underinsured, or their insurance didn't cover. We, on an annual basis, influence some 15,000 individuals, groups, other entities. We have worked with 50 support groups implementing screenings and educational programs and our special events. So we continue to make an impact, and we will use the vehicles that we have to reaching out to our African American community and other communities of color. We have organized vaccinations at many of our churches, as well as other locations within the heart of the communities of color. Last year we screened or helped to organize so that some 3,000 people have gone through our screening program. So we're extremely proud of that. My husband had Alzheimer's disease and sadly passed away. But during his journey, we experienced disparity and racism. He had an altercation with the police department, which ended up costing us a lot of money. He spent 2 nights in jail, was thrown to the ground. He went to his grave with a big scar on his shoulder. The young police officers need training how to work with someone who is going through a crisis situation so they can de-escalate and not a manner in which my husband had to experience. I said something needed to be done. And I eventually met with our chief of police. This resulted in every single police officer in the city of San Mateo going through the Alzheimer's training program. This resulted in a bill that was presented to the state legislature last year, AB 2583. It did not pass, sadly. That did not deter us. The president pro tem at that time was able to get $900,000 for San Mateo County. That money was used for additional training and staff. Our police chief also instituted a program where if a loved one or a caregiver is caring for someone and they have an episode and they need the police, there's a registry now. It's volunteer. People can sign up the person. If they have an encounter with the police, then the police will call in, see what the situation is, because it could be someone with autism as well as Alzheimer's. We are now making sure that every single organization in the city of San Mateo knows about the Project Guardian, and we're hoping that other cities will adopt the program. I'm hopeful one day there'll be a bill that all police officers and peace officers in the state of California will receive some kind of training if they haven't already. I think about my mother, who died at 104. She didn't have the opportunity to vote. She couldn't go to the library until she moved to California. So each generation is standing on the shoulders of their past generation. And hopeful, I, along with my generation, is serving as role models. I'm just one person, and I hope that they can see in me what I've been able to do, not by myself all the time, but how communities have to come together to make a difference.